So what inequality in Black health trickles down to? So with all these inequalities we're talking about, what do they trickle down to? What's the final effect of it? Their management of chronic diseases is much less assertive and less aggressive. So you realize that the way their issues are taken seriously is not as serious as their Caucasian counterparts, okay? And they may have their symptoms more easily dismissed because when they present, oh, he's just drug seeking. They can also label it as he's a frequent flyer in the ER, something like that. And tests may not be ordered the same way as compared to people of other races. So maybe instead of the doctor going ahead to be very aggressive in the way he or she is going to request labs and investigations for that particular patient, the research shows that at times the test may not be ordered the same way. So doctors, when you start practicing in Canada, and especially because we are learning about Black health today, there'll be a day we'll learn about Indigenous health, and then we'll learn about LGBTQ and all. Like, when people who are different from you come before you, please just be a bit sensitive to find a way to know how to deal with them, so that they can also get the best out of the healthcare facility and the healthcare system. And Blacks may not always get the same discussion about treatment options. So, for example, if there's a particular condition the person has and there are 5 options, maybe the research shows that they may be told about just 2 or just 1 or just 3, and the 2 others, they may not even talk about it at all. And then another thing, or the consequence of this whole disparity in Black health, is that there can be assumptions about the overall low health care literacy. Oh, they don't know so much. Don't worry yourself about them. They don't know a lot. So why do you even bother? That kind of thing. It's a lot of bias in the healthcare industry that we need to do better, especially as people who are learning to prepare for the QE1. We must learn better. And I'm very glad that the Medical Council brought it up, that it's one of the things you need to master so far as your exam is concerned. So what inequality in Black health trickles down to, we still continue. There can be some presumptions. And you remember that when we're reading the objectives, we learned it. And one of the presumptions is that, Black people have different pain threshold. So maybe you may be in an emergency room. 2 people may be presenting with pain. One is Black, one is of a different race. And it could be that the Black person may have delay in getting analgesics as compared to the other person. And there's also the assumption that, the Black person will abuse pain medication, right? So that's also another bias, and that's another inequality that is in the system, which can be in the minds of, some practitioners. And that is why we have to do better. And the issue of Black health is not only an issue with the patients, it's also an issue with even the doctors. So, and I don't know whether anyone wants to contribute to this conversation. Some Black doctors are regularly mistaken for cleaners in the hospital, even though they are all wearing the same scrubs as all other races, right? But they may be seen as floor aides. Oh, come and push my cart for me. Meanwhile, maybe the person may be a doctor or a nurse, right? They may be confused as housekeeping staff. They may be seen as personal support workers, and they may be seen as nurses. Somebody said true. Do you want to share?
I have a friend who recently got into residency in the Royal Alex, and she told me that when she started working, that nobody believed that she's the only Black OBGYN physician. And when she started, they were looking at her like a cleaner, right? Like someone who was a messenger, but it was so bad, but she just had to keep on doing that and she actually has this aesthetic look. She looks very smallish, very lean, and they were like, this can be a doctor, right? So,
Yeah,
but when they come close and they look at her tag and they say, wow, she's a physician.
yeah.
So I'm just trying to buttress that. Yeah, it's really true.
Yeah, and you realize that, you can even at times have people who said, I don't want this guy, I don't want to use the word, but I don't want this particular person to even touch me, right? While you are trying to take care of the person, no, you don't qualify to touch me. And I'll be touching on that as well. And at times, even a Black doctor may be confused as a nurse. right? Hey, nurse, come here, come and help me. It's tough. So at times, even as a Black doctor, you constantly hear that they'll be asking, where are you from? Go back to your country. Hello, I'm
Doctor,
listening. Sorry. Yes.
sorry, can I share a point about this? So
Yes.
one time also I was working. So I'm like visible minority. I'm wearing hijab, and the doctor I work with, he's a Black doctor. He's
Mm-hmm.
pediatrician, and now he actually in Saskatchewan. He used to
Mm,
be in Ontario. So one time we had a patient from France.
mm,
So he's like a France immigrant came to Canada,
mm,
and he brought his child who was like, slightly above 1 year old. I don't remember now, like 1 year and maybe 18 months, almost 2 years. So the moment I open the door, I see the child. He's really, yes, he's how to say, he's scared and he's in one corner,
mm-hmm,
and he's like, you can't tell he's scared. Then I left. I didn't say anything. Then the doctor came and he examined the child, and he was exactly the same. He was scared in a corner. After that, I came. So that French dad was telling me, "Oh, my son is scared of you, me and him, both of us, and that's why. Did you see how he's scared?" Then I was like, "No, he's scared because we are stranger to him. The
mm,
child doesn't say I wear hijab. He doesn't. He cannot tell.
yeah,
He's just human.
yeah,
Doesn't say this is a Black person. He just see a person, but strange person to him.
yeah.
But no, my son is scared of you. I don't know. But that's
You realize that that's what I'm saying. This thing is not even about Black health alone. It's about, like as you said, you are wearing a hijab, right? And then, you know, who are you? And then they will say, were you born in Canada? You know? And where are you from? You could even be a Canadian citizen, and that can happen. So I just want you to understand that this is
Dr.
something
Bruni,
yes, please.
I have an experience that I want to share with you too.
Okay,
There was a
sure.
particular time that I went to visit the doctor, but this time around, it's not even as a physician because I just went for health checkup.
Mm-hmm.
And when I reached, because maybe the assumption of the low educational levels of Black people,
Yeah.
she examined me standing up, not
Mm.
even on the couch, examined my abdomen, my chest,
Wow.
everything, palpation with all that while I was standing up.
Mm-hmm.
So maybe it's because of the judgment that we don't know what is expected. So I
Mm-hmm.
said nothing because I knew there was nothing wrong with me, but it was just for paperwork. But all the
Yeah.
examination was done whilst I was standing up. I wonder how he was able to detect if I had any abnormalities in my abdomen if I was standing. But I just look at him like that, and then when I was done, she asked me to leave. And there was another experience that I had with my landlady here. The
Mm.
mother came to visit her.
Mm-hmm.
So immediately she said, oh, my new roommate is from Africa. The first thing that the old woman asked me was, she need a house help. So
Mm.
once they see you, they have that judgment that you
Yeah.
have to be a house help or a
Yeah.
cleaner or something like that.
Yeah.
So that was an experience that I wanted to share with you.
Sure. Yeah. So
Mhm.
you real and then I even read an article which said that there was a resident, first year resident, radiology, and another resident, of course, they didn't know themselves. And so the doctor was sitting in the doctor's room, right? And this resident just came and seeing the other resident sitting down. Oh, I think I'm in the wrong. Why? Because there's a Black person sitting there, right? So these are all things that doctors, in as much as we are learning QE1 and everything, but I'm happy that the Medical Council wants us to learn about this. Please, let us be agents of change, and not just towards Black people, like everybody. Look, beyond your skin color, you are a human being, okay? And I don't want, and I'm sure maybe Black people may also have their own prejudices, and all those things. And this is an opportunity for us to all learn and unlearn certain things that we've grown with so that we can be able to better help people. So we don't see people and we just assume that, oh, these people, this is who they are. No, take your time to get to know the people. I don't know whether someone else wants to say something before I come on. So you see, this thing we are talking about, in as much as we're preparing for QA1, I can now tell that some Black physicians feel that their competence is occasionally questioned. And I don't know whether you've come across that. And that the article says that the Medical Council even talks about it, Some doctors feel that their competence, so you can have two people, they went through the same residency or they went through the same training, and the black person always has to prove himself. In fact, some patients do not accede to the treatment plan until a white physician agrees with it. Okay, so maybe you may have a black physician who may prescribe something, and then the patient will say, no, I want to see a white physician first. So these are all things I want you to pay attention to, because we'll be answering questions on them. Okay. And then some patients may even call the black doctor the N word. I don't want to mention that word, but I'm sure all of us understand. Okay. So these are all things that we need to know. So some, even with those in training, because all of you be going through training, whether you be doing the practice with the assessment or the residency, some feel a lack of action when experiencing prejudice or racism in the presence of other colleagues of other races. So some black doctors, some people of minority groups, like what my dear doctor said, wearing a hijab, right? I'm very sensitive to all these because we interact with everybody, and at times when they feel that there's prejudice among them, they even feel that their colleague doctors who should be speaking up for them don't do it. And peers have also made offensive remarks about their black colleagues, how they look, and even their hair. Sometimes, oh, can I touch your hair to find out how you are? I've had people coming to touch my skin, well, let's wipe off. But, you go like, man, what is all this, right? And some black medical students have been told they'd have to work twice as hard just to be considered as competent as others of other races. So if the standard is one for everybody, for you as a person of minority, and I want to really spread it to other minority groups as well, Arabs and, Oriental people, everything, you have to work 4 times more. So the question is this: how are we going to deal with black racism in healthcare? And then we'll go into the questions. Number one, we've got to acknowledge that racism exists. We've got to acknowledge it. Number two, doctors have to become conscious of how they treat people of a minority group. As I said, this does not only pertain to the black community. Every minority group, First Nations, you have to be very, 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 very sensitive when you are dealing with somebody who is not like you. So even if you don't get anything from interacting with Dr. Bruni, please get this. Let us respect people. Like that, the doctor who commented that she's thankful to God that, in Islam, they don't see color. The same thing applies to my religion as well. I'm a Christian as well. And all people are the same before God, right? So that's something we need to be very conscious about. And I'm sure it's a similar teaching in many, many, many religions as well. And doctors have to become conscious of how they treat people of minority group, incorporating cultural, racial safety into a hospital or clinic's broader patient safety and reporting procedures. And when people of a minority group saying that something has been done to them, it should not be ignored. Okay, and creating better and more equitable staff recruitment and human resource practices. And I'm very happy about that. For example, in SIPA, the Saskatchewan Practice Ready Assessment Program, what they do is that, so they try their best to make sure that the selection of candidates is equitable and is similar across countries and across races and across experiences. So they don't just, and I'm talking about after they've all gone through competence assessment, so they don't just go choosing from one country alone, but they do their best. Okay, a little of the black people, a little of people, Islam, a little, all those everywhere, so that everyone is equally represented. Okay, and increasing the number of black health professionals, and I'll not only say black health professionals, but increasing the number of doctors who come from various backgrounds. so that everybody's equally represented. So that when, like what my dear doctor said, when you see someone in a hijab, you are not surprised. They are brilliant, they are wonderful people who are also here to contribute to the healthcare system. When you see a Caucasian, the same thing. When you see a Black person, the same thing. When you see a First Nations, the same thing. Okay? And collecting and analyzing data on racism will also help. So that's also something I really, really want us to pay attention to. So doctors, I don't know whether this lecture has made sense before we go into now dealing with this topic in the MCCQE1. Does somebody have a question or contribution, or has this opened your eyes in something you were not considering? Has this
Thank you
really?
so much, Dr. Bruni. I also want to share,
Yes.
when I was doing my job, at one of my job, I also experienced racism. The thing is that I'm also visible minority, so they were all Caucasians over there. So whenever I asked my immediate supervisor for any question regarding something, because I was new over there, I noticed that she was also making like like gestures, like she doesn't want me to ask anything, right? Making faces. Sometimes it's just gestures like which tell you, right? Like she doesn't like you just because of the skin color.
Sad. It's very sensitive. And doctors, please, on this line are many people, all of us, and I'm just hoping that all of us will be able to pass our QE1 and get into the healthcare system. And at least if 84 people of 84 people decide that, look, I'm not going to look at someone's skin color. I'm not going to look at where you are coming from. I'm not going to look at how you are dressed, whether you are covered in a hijab. I'm not going to look at any of that. But I am your colleague. I'm your brother. I'm your sister. I'm here I have your back. Let's work together to make sure that we give the best of healthcare to our patients. Doctors, it will change the whole landscape. Dr. Idris,
Dr.
before
Bruni?
Yes, I also want to
yes.
add that. Okay, Dr. Sabine, after you.
Dr. Bruni, so in these situations, how to handle those difficult like supervisors or it's very difficult, yeah.
It's very difficult because the other point, the person may also say, I didn't mean anything like that. And then it changes the whole dynamics, right? But I think that, but one thing I've seen happening over and over and over again now is that the medical, like the various colleges, in fact, even in Saskatchewan, there's an upcoming anti-racism class for doctors, virtual class, which is coming up. So you realize that it is something the society and especially the medical community is becoming aware about. And for me, that gives me a lot of hope that, you may not be able to change it. It's a systemic, it's there, it's ingrained, right? But as time goes on, like Dr. Inuebe, Dr. Sadav, Dr. Metari, all of us get into the system and practice and ace our QE1, we can start changing the conversation one by one, like being open to it. And when you see that somebody is being discriminated against, and as I said, I don't want to limit this, even though it is Black health, I don't want to limit it to Black health alone. But if you see anybody, please, anybody being discriminated against, stand up.
I think we've got to do anything we can to have my computer connected to this internet.
Stand up for the person. It's very important. I plead with you. Stand up for your brother. Stand up for your sister.